everyone, and welcome back to the Wildlife AMA podcast series. I am Devanshi Saini, and in the second episode, we have someone really special for you. Often referred to as the Dr. Dolittle of Indian veterinary sciences, he is the principal scientist at ICAR IVRI, head of the Center for Wildlife in IVRI, coordinator of the RVP, wildlife veterinarian, surgeon, researcher, and a humble mentor. With over 175 research articles, 55 clinical papers, 40 technical articles, and multiple papers to his credit, Dr. Pawde is internationally recognized for his work in soft tissue surgery, regenerative medicine, acupuncture, and veterinary dentistry. And I can go on talking about him alone for the entire podcast. But let me welcome Dr. Abhijit M. Pawde, sir.
Thank you so much.
Sir, I'm honored to be part of this podcast with you.
Thank you so much, and I really appreciate your efforts for this. Glad to be here.
What makes Dr. Pawde's journey especially fascinating is his extensive hands-on work with wildlife species, from large carnivores to endangered animals, and his deep experience with one of India's most iconic species, the Asiatic lion. Today, we will dive into the science, challenges, unforgettable moments, and conservation lessons that come from working so closely with these magnificent animals. Sir, I think we should go to the questions now.
Yes,
so,
certainly.
Sir, my first question would be, before we talk about Asiatic lions specifically, could you tell us how your journey into veterinary medicine, wildlife veterinary medicine began, and what has attracted you to working with wildlife species?
Nice question, I must appreciate. My journey of wildlife treatment started in 1991. I strongly believe that nobody learns right from the childhood, or nobody comes with the full skills when an individual comes out of the mother's womb. Experience teach him many things, and nobody is perfect in that. I put it like that: perfection is the privilege of Almighty alone. Nobody is perfect than the Almighty.
True, sir.
So, in 1991, the division of surgery was not was under the experimental medicine and surgery, a combined department, and we got a call from Dudhwa National Park. The then in charge of veterinary surgery was Dr. Gajraj Singh, my mentor, who took me along with him to attend a rhino which was born and brought up in Kanpur Zoological Park, which is commonly called as Allen Park, named after a Britisher. That animal was sent from Kanpur to Dudhwa to change the bloodline in wild rhinoceros. Fortunately, one female rhino of Dudhwa National Park called Asha was in heat, and it was being chased by a wild rhino which frequently used to migrate from Nepal to Indian forest territory, and then it started chasing the female in heat. Out of curiosity, the zoo bred rhinoceros called Lohit, which was brought from Dudhwa National Park, was also curious, and he went near the female in heat. This poor rhino, who never had experience how a wild rhino behaves, was gored by its horn. The horn was no less than 13 or 14 inches, and he started goring this poor zoo-born captive rhino. No wound was less than 18 to 24 inches, almost 2 feet. And it was almost due to injuries and the stress, plus the blood loss, the animal was under stress. So this animal was being treated by my teacher. Of course, surgery is a teamwork, so I cannot say that it was stitched by me alone. And then we used around 1 dozen of cutting or traumatic needles, and then the skin of this animal was sutured by Vetafil and then the shining nylon material which is used to tie the packs.
So that's how you got so fascinated by wildlife.
Yes, yes.
Sir, I can sit here and listen to all your stories here. So, lions are often seen as symbols of strength and majesty. From a veterinarian's perspective, what was your first experience working with a lion?
The first ever lioness which I have treated with Dr. R.C. Patra, the then scientist in Division of Medicine, IVRI Zatnagar. We both were sent as a team to attend this lioness at Kanpur Zoological Park again, which is called as Allen Park. The lioness name was Gauri, and Gauri was not eating for a long period of say 10 days. But unfortunately, I must point it out here that there was no squeeze cage facility in the cage where the Gauri was being kept or housed. So, what to then? Normally, these even captive wild animals or big cats are very much fond of moving birds or moving rats or moving rabbits, so that they do get their wild instinct awoken, and they attack either a poultry bird or a domestic rabbit or some sort of a small goat kid. But despite these trying all the three natural preys, the animal did not show any interest in these live preys. So what to do? The lioness was coaxed, and for the first time, what we did is, in a syringe, we used the paste of molten ice cream, which was forced in her mouth. Everybody was taken aback. What you are doing? A carnivorous is being fed vanilla ice cream. So is it a joke? But then it was a happy founding situation that the lioness ate 4 cups of ice cream. So that everybody was astonished what he did. So it was hit and try, but then somehow we wanted that the lioness should survive. And the next day, on a small boiled piece of chicken, the ice cream was smeared. This is how I generated my interest. But then in coming years thereafter, when Itawala and Safari was started, I started treating another lioness called Kouri, which was of course had multiple problems right from canine distemper, and the lioness was quite attached to me. She used to make noises and almost roar at me to call me. So this is how I developed interest in the lion treatment, and thereafter.
Well, who doesn't like a good vanilla ice cream? Sir, I have another question. So Asiatic lions are often celebrated as one of the greatest conservation success stories, aren't they?
Yeah.
So, sir, yet scientists describe them as vulnerable. Why does a growing population not necessarily mean survival of the species further?
To me, it may be my personal perception. If you consider lions in India or lions for globally, even in Africa, lions you can see the decline in population. In Indian perception, if you see, in 1800 or late 18th century or beginning of 19th century, there were only 20 odd lions surviving as per the census. Now what happened is, there is anecdote or something, or truth, that in the Shasan Gir, one of the Nawabs brought this lion, these lions and two from Africa, and to look after them, he also brought some African human beings. They are called as Siddhis, and there is a village called Siddhi in that Gir forest, Varshasan Gir forest. So then, now if you consider to the 16th census of lions of 2025, you have 891 lions on record. Now then, why they are considered as vulnerable is, number one, there is genetic drift, because there is no genetic diversity as such. The same lions which were brought long back are being bred in them, and inbreeding is one of the handicap for it. So these lions, despite the best possible practices of conservation being adopted, rising from 20 to 891 is the biggest success story to me. Of course, there are episodes. If you look to the data of 2018, there were deaths of 28 lions in 2 weeks, which is quite a sizable. And this is a great risk which compelled many of the scientists and land conservation activists, which has led what has happened on 15th August 2020 to start a project line. But it's not new. In 1972, the same effort was made for conservation of
Tigers.
So this is how the story goes.
So, sir, to sum it all up, we need more genetic diversity in lion species.
Certainly we need it.
All right, sir. So let's get to our next question. So one of the biggest concerns for Asiatic lions is that nearly the entire population is present in a single landscape. So from a wildlife veterinarian's perspective, how serious is the risk of a disease outbreak affecting the entire population?
If we believe to conserve the lions in a true sense, then I personally feel that we must shift few of the lions by translocation programs or having genetic diversity, in the sense like the second best landscape for lion propagation, lion population propagation rather, would be Kuno in Madhya Pradesh, because the history says that it was a track for lions and area in good olden times.
sir, another question I'd like to ask you.
Yeah.
So, in 2018,
Mhm.
so
And neurological symptoms. The best example of is of the rescue center at the Shakarbagh Zoo of Junagadh, where many of the lions are with neurological disorders, which is a sequelae of post-distemper. So now why the wildlife veterinarians or even the veterinarians in that area should learn. There is recorded death of 28 lions in 2 weeks, and that has alarm. What to do? It is better to vaccinate the stray dog population in adjoining area of the forest and village, which is the junction. I don't say that dog is sentinel animal for it, but yes, many of the stray dogs they harbor this virus, and they because when there is encroachment, deforestation, the prey population decline. As a result, these animals, you will be surprised to know that a lion can move 40 kilometers in search of food or for migration or for making a territory. So these animals used to escape, and they have gone and killed the domestic dogs which were not vaccinated, and that was probably entry. And as I have said, that this is an inbred population. Inbred population does not have much of disease resistance. They are very much susceptible to any of the infections, and at the same time, which was not given that much of attention could be a co-infection of babesiosis at that time.
So I hope all of us have taken notes about the disease and also what we can do to protect our lions from CTV infection. So what are some of the most common medical conditions and diseases that you have encountered in lions during your tenure?
Mm, at Itava Lion Safari, when I went, then one of the lioness has developed mm, maggots near the nostril as the other lioness crashed her from the other enclosure. That was one. The second one was oldest lioness there at National Zoological Park had developed some wounds. in the year 2024 or 25 like that. And then one of the quite interesting case of a lioness called Shailaja, which was recently brought from Shasangir or Junagadh Zoo. Two females and one male was male lions were brought from Junagadh Zoo. They were kept in Rajkot Zoo for a few days, and from there they were transported to the National Zoological Park, Delhi. What happened is one of their own mates pushed this Shailaja lion's nest from a height, and she fell down into a trench. As a result, the lioness developed hindquarter weakness as well as posterior paralysis. The lioness was treated by me with acupuncture. I told them these the points are to be treated with laser acupuncture. Fortunately, we could get one laser acupuncture machine from a private practitioner in Delhi, and everybody said now she has developed bed sores or decubital sores for a prolonged recumbency, and even the advice of the foreign vets was taken. They also said it is better to put to the animals sleep. To my utter surprise, one day the lioness started getting up and tried to walk. So I advised them now not to keep her in this slippery cage, rather than taking her into a veranda with a raw floor or a kacha floor, where the lioness could place weight on her hands and try to walk. So that was a breakthrough. My one of the rarest experience in treating a precious lion called Manan, who has sired so many lion cubs there in the Etawah Lion Safari, which had a tumor of of origin of hemangiosarcoma on the right hip. Somehow, when I went to treat that animal, there was no authority to permit him, regular authority to permit me to tranquilize that animal. And there was, since it was so many casualties and it was a precious animal, so nobody allowed me to take the biopsy in tranquilization. So the animal lion, it was a majestic and a huge lion, almost of 170 kg. The animal was kept in a standing position in a squeeze cage facility, and the tumor growth was then desensitized with lignocaine or local analgesic, I should say, and then the area was desensitized, and in between the two bars, I do remember Dr. Gaurav Srivastav was a vet who was a quite junior vet. He has helped me, and even he was astonished that how a lion can be operated in local analgesia. So I removed that, resected that tumor, and there was an uneventful recovery. The wound healed it naturally, there was no recurrence. Thereafter, the lion survived for 5 years and then died due to old age. So this was one of the very exhilarating experience for me.
So when you are telling all these stories now, I feel like I'm part of all those times when you were treating those lions.
Yeah.
It feels really good to hear them from you. First-hand experience of yours.
Yes.
So, okay, this is my favorite question. So, could you tell me one of your cases which is your most favorite, one which is very funny, and the other, which is emotionally attached to you?
One was the same. I would like to reiterate that the Manan lion, but of course Many of them, or even me, will rate it as unethical to operate a lion in a local infiltration analgesia to reset the tumor on the right hip was one. At the same time, going in the cage of Shailaja lioness and then giving acupuncture to her was because if you pass my hand through the cage and the bars would interrupt the rays of laser would be what you can say a futile attempt to treat some animal. Then I was of course emotionally attached to one of the oldest chimpanzee in the history, but of course she could not come in the Limca book of world records. Rita chimpanzee, which was almost approaching 60 years, and the animal has developed some in its anal or the hip pads some sort of a wound. She was quite emotionally hyper for it, and when it was dressed, the next time it was not coming down and starving at a height. Somehow she was treated without giving any of the sedation, and I was speaking to her. I asked her zookeeper to keep her busy in talks, and she was speaking and I was patting her head, so she was quite comfortable. And in between I dressed her hip bones with it, and she has literally starved. So while patting her head, I have forcibly pushed few of the dry fruits like cashew and almonds in her mouth. So the zookeeper said that she will chew off your fingers. She is very aggressive. But then, to everybody's surprise, she ate two or three that day. And then next day, when I went with a banana, she she was asking for that banana, but she was holding the bars of the cage and asking me to feed her forcibly. So this is how we are emotionally attached. And lastly, one of the a great this thing experience was in Dudhwa National Park. One elephant cow, probably if my memory doesn't deceive me, it was Jamnakali, who had a tail wound, and I was about to treat that wound. I was surprised. They had 12 animals. Why 11 went and why this animal is being tied? I thought that there is something wrong or there is no Mahavat. And then when I went, the Mahavat said that you go and see the case and just have lunch and come. In football, there is a kick called scissor kick. I am being pushed by captive elephants, by their trunks, by their forelimbs, or even slapped by African elephant in Delhi Zoo called Shankar by its trunk, and also threw my mobile from my pocket. But I never got a side kick, and the first ever kick I received in by a captive elephant was an experience at a Dudhwa National Park. So these are all my experiences.
So this elephant cake, you have a picture of it, right?
Yeah, probably somebody has captured. At the same time, there was Rajmangala, huge elephant, which was punished and kept in Chadbir Zoo because the elephant became violent and it has entered a mall and killed a person over there, and also its Mahavat. And then it had a chain burn wound in its right hind leg. So nobody was ready to dress it because throughout the year, it was the first animal in my life which I have seen that throughout the year the animal's behavior was like must. So then finally I dressed that wound with one of my old favorite mixture of calendula, homeopathy liquid with glycerin, and there was tremendous improvement. So that was the most astonishing and thrilling experience for me.
I'm just so glad I'm here with Pawde sir right now. Okay, sir, one final thing. I want to have a rapid fire session with you. And I've also prepared some questions. So let's shoot them. One word that describes a lion.
It's a majestic animal.
Most underrated wildlife species.
Vulture.
Field work or laboratory work.
Field work.
Most important quality in a wildlife veterinarian.
Patience.
One conservation success story that inspires you.
Of course, the lion and partly vultures.
One animal you still find fascinating despite decades of experience.
Elephant.
Sunrise in the field or late night rescue operations.
Sunrise in the field.
Okay, this one I also want to know. One book every wildlife student should read.
If it is a Bible of wildlife, then it's a book by Murray E. Fowler. Every veterinarian or aspiring wildlife vet read. So thank you so much. It was a thrilling experience for me to be on your podcast. So thank you so much for interviewing me.
So before we end this discussion, I want you to tag another wildlife veterinarian for the next episode and tell something about them.
I would like to tag Dr. Gauri Malpur, who is from Goa and has a vast experience in wildlife herpetology. And specifically, if you ask me, she is a specialist of crocodiles. So you must tag her for her reviews and an enriching podcast from her on wildlife, that too on crocodiles. But then she can speak on any aspect, as she has worked on Central Zoo Authority as a technical assistant.
Sure, sir. We are definitely reaching out Dr. Gauri. Dr. Pawde, sir, thank you for sharing your experiences, insights, and stories with us today. Stay tuned for future AMA podcast episodes featuring leading voices from the world of wildlife veterinary science, conservation, and research. Until next time, keep learning, keep exploring, and keep buzzing for wildlife. Thank you for joining us. Goodbye.